Look, if you're struggling with not knowing if a supplement that you're taking is providing actual benefit for you, or if a supplement that you're taking is full of false promises, you're not alone. That is a very common experience. And I want to illustrate with a brief story from a patient inquiry to me about garlic. So she was promised that if she only takes garlic, it would solve many of her health problems. X, Y, Z, A, B, C. She began taking garlic and she became frustrated because she was not seeing the results that she was promised. And not only did she stop taking garlic, she stopped taking all supplements because she became frustrated, not knowing if she was just wasting her money. The good news is there is lots of research out there on botanical agents, vitamins, minerals, and supplements. We just have to know how to look at the research. How was the scientific study performed? Who were the participants in the scientific study? How many participants were in the scientific study? And what were the results? Clearly, what were the results? And if we can understand what the science says, we can allay so many of our frustrations around holistic medicine, around natural agents. So garlic is a culinary herb cultivated worldwide, and I want to talk about glorious garlic today. I love garlic for a few reasons. Firstly, I love its flavor. It's an incredible complement to so many of my tasty dishes and recipes. Secondly, if you use it every day, if you use it in a large enough quantity, it can actually be beneficial for certain health conditions. And number three, it helps my meditation, and I'll get into that in a moment. So it's an herb cultivated worldwide. It's related to onions and leeks and chives. It's thought that garlic is native to Siberia, but it was spread throughout the world over 5,000 years ago. The bulb of garlic contains the components of cysteine sulfoxides. Many of the pharmacological effects of garlic are attributed to allicin, adenine, and allicin. When the garlic bulb is crushed or ground or cut, the allicin constituent is converted to allicin by the enzyme allinase, which is, allicin is really the active ingredient. So crushing or grinding or chopping helps to release the active ingredient. Some garlic supplements are aged. Garlic is aged to reduce the content of other sulfur compounds and the odor commonly associated with bad, stinky garlic breath. The process to produce odorless aged garlic extract reduces the allicin content to only about 3% of what is typically contained in fresh garlic. So use fresh garlic as much as possible. You can certainly take really concentrated, standardized extracts of garlic powder, but on a daily basis, cut it, chop it, crush it to release those active ingredients. Now, I want to talk about kind of three different classes of studies. Studies that show that garlic might be possibly effective or likely effective. Studies that show that there's insufficient evidence, insufficient reliable evidence to rate it, and maybe because they were very small studies, only done on 10, 12 people. Maybe there were only 2 studies and one said yes, one said no. So insufficient reliable evidence to rate doesn't mean that it was ineffective. It just means that we cannot extrapolate too much based on the science that's currently available. So possibly effective, 2 thumbs up. Insufficient, kind of like this. We just don't know yet. And then possibly ineffective means that enough study has been done to show that it's not likely going to be effective for those conditions. So first, let's start with the bad, possibly ineffective. So garlic has been shown to be possibly ineffective for the prevention or treatment of breast cancer, cystic fibrosis, gastric cancer, H. pylori in the stomach, lung cancer, taken internally as a mosquito repellent, and the condition known as preeclampsia. Those we can kind of rule out. If you've been promised to take garlic for one of those conditions, the science pretty much says, nah, it's not going to be helpful for those conditions. Now let's talk about that middle category, insufficient reliable evidence to rate. Maybe it was a small study, maybe it's just 1 or 2 studies and they show conflicting results. That doesn't necessarily mean that it's ineffective, we just do not have enough data yet to conclusively say, yes, take garlic for the following conditions: alopecia or hair loss, angina, which is chest pain, athletic performance, benign prostatic hyperplasia, the common cold, and I know a lot of people take it for the common cold, topically applied to the feet for corns, fibrocystic breast disease, metabolic syndrome, osteoarthritis, and topically for warts. Again, if you've been recommended to use garlic for one of these conditions, I wouldn't hesitate. I would give it a try. The science is just inconclusive at this point. Now let's talk about the great stuff that garlic can do. Probably effective. So atherosclerosis. Studies been done on a standardized garlic powder, 300 milligrams a day, shown effective for helping the progression of atherosclerosis. Also diabetes. A 2015 analysis of results from 7 clinical studies show that taking garlic powder in the amounts of 600 to 1500 milligrams daily, or garlic oil about 8 milligrams daily, reduced fasting blood glucose levels after taking it for 12 weeks. So that's the key. You have to take it long enough to see the effects. And in fact, with diabetes, it may also be effective when taken in combination with a common medication used for diabetes like metformin. So 300 milligrams 3 times a day in combination with metformin for 24 weeks reduced fasting blood glucose approximately 70% more than with metformin alone in patients with existing type 2 diabetes. That's exciting to me. Next, let's talk about hyperlipidemia, which is basically high triglycerides, high cholesterol, specifically high bad cholesterol, the LDL. Overall, clinical research suggests that taking garlic supplements daily for more than 8 weeks may modestly reduce total cholesterol and LDL cholesterol levels in patients with hyperlipidemia. However, garlic is unlikely to significantly increase the good cholesterol HDL or reduce triglyceride levels long term. So good for total cholesterol and good for lowering LDL. Next, let's talk about high blood pressure, hypertension. Taking garlic can decrease systolic blood pressure by about 7 to 9 points and diastolic blood pressure by about 5 to 6 points. Doesn't seem like much, but with everything else, if all you have to do is add some garlic to your dinner or to your lunch every single day, that can add up over time. Next, prostate cancer risk. Men in China who eat garlic about 2 grams a day, that's about 1 clove of garlic, seem to have about a 50% lower risk of developing prostate cancer. Also, a pooled analysis of epidemiological research suggests that garlic consumption may be associated with a 20% decreased odds of developing prostate cancer. So again, a simple thing that you can do: crush it, chop it, add it to your lunches and dinners to help reduce your risk of prostate cancer. Next, let's talk about tinea. So tinea is fungus that grows on the skin, on the body. It can grow on the body, it can grow on the feet, so athlete's foot. And it has been shown effective for that as well. 0.6% to a 1% extract of ajoene, so AJOENE, a constituent of garlic, applied twice a day, seems as effective as a 1% terbinafine, which commonly in the United States is known as Lamisil. So just in summary, helpful for tinea, helpful for high blood pressure, cholesterol, diabetes. Yes, take garlic, use garlic as food, use food as medicine to help you out. Another way, and I promised I would tell you this, another way that garlic helps me out is through meditation. You see, I don't like the pre-minced garlic that you can buy in a squeeze bottle and squeeze into your pan as you're cooking. I like to chop it. I like to peel off that papery skin, put it down on a chopping board, and just the repetitive motion and breathing deeply, that incredible aroma of garlic, breathing in deeply as you chop. It doesn't water the eyes like onions do. So just the process of using your fingers to peel off that papery skin, and the motion of chopping, and just being quiet and chopping it finer and finer, scraping it around your chopping board, chopping it finer and finer. It is fantastic for me. I can go, if my anxiety level's at a 6 or a 7, chopping a few cloves of garlic, I promise you, takes me down to a 3 or 4. It's that easy. So I love garlic for a variety of reasons, and I love science because it helps to teach you not to be frustrated about promises. Yes, we need to look at the research, and don't be sold a false promise of goods. That's important. But if you look at the research carefully, there is tons of it. For botanical agents, vitamins, and minerals, you just have to know how and where to look for it. My name is Dr. Shelton. I'm with Zenith Labs. We have a website, zenithlabs.com. I encourage you to check that out. We have a Facebook page, an Instagram page. Please like this channel, share it, subscribe to it, because I want to inform as many people as I can about the truth that scientific research has and can provide to promote your optimal health and wellness. Thanks so much for your time.